This is a lot less than those programs, but it's still a significant contribution. I would say though, that by doing this through this program, we don't have a lot of the expenses that private insurance companies have. So even though it's not, inexpensive, it's much cheaper than doing it through private insurance. Private insurance premiums are $2,700 a year on average. Our premium is about $300 a year for the typical worker. And the reason is that first of all, for this program, because it's structured like Medicare or Social Security, you pay in from your first job to your last job. So everyone's paying in throughout their career, where for private insurance, a lot of people don't think about it till they're 60. That's the age people typically buy it. So when you wait that long to start paying, it becomes more expensive. This is a more intelligent way to pay for it because people pay in throughout their whole careers, which makes it more affordable. We also don't have the expenses private insurance companies have. We don't have underwriting expenses. So insurance companies, about a third of their expenses are hiring people to determine whether you have pre-existing conditions, and if so, to price your policy accordingly based on the risk. It's a risk-adjusted premium. We don't have to hire people to determine how risky it is to insure you, every single person that we're insuring, and then price the premium accordingly. So we save a lot of money because we have the same premium for everyone. We cover everyone. So that saves a lot of money. We also don't have claims adjusters on the back end who try to not pay claims. We try to pay everyone's claim. Anybody who needs care, we'll pay your claim. And we don't try to nickel and dime people on the back end. We don't have fine print. We try to find reasons not to pay the claim. So we save a lot of money on the front and the back end on staffing. And we don't have, corporate retreats in Hawaii the way private insurance companies may very well do. And we don't have CEO salaries that are $1 million. We don't have expensive lobbyists. All of those expenses we don't have. And for those reasons, even though we realize it's still not inexpensive to pay $300 a year into this. You're getting a very good bang for the buck. You're getting a lot more for your money than you would through private insurance because we don't have the expenses they have, and because you pay in throughout your whole career rather than just towards the end.
Great, thank you. Our next question is kind of a combined question is on a similar note from Taylor, John, and Rachel. And it's two parts here. First part is, my son is under 18. He has been told that money will be taken from his pay. First of all, is it correct? As he's never been able to find market long-term healthcare for a 17-year-old. And why not have this applied to people over a certain age?
Sure. Great question. I understand that. This is designed like Medicare or Social Security. Programs like this are universal programs. There was a temporary grandfathering in of people who had coverage prior to implementation. So the intention there was to cover if people had been paying in for 20 years into private insurance, that when this was enacted, that they should be able to opt out of the program. It was never designed to be a permanent opt-out. It was a temporary option to apply for an exemption, really intended for people who had coverage prior to implementation. For a program like this to work, just like with Medicare or Social Security, everyone needs to be in the program, or virtually everyone. That's how it works. If you make it completely voluntary going forward, that would mean that only people who thought they needed care would participate. Other people who didn't think they would need it wouldn't participate. And that would drive up the premium. It's called a death spiral of premiums. That makes premiums very, very high. And in the insurance world, that's something that's unsustainable. And so for the premium to be as low as it is, it's important that everyone in Washington State going forward be in the program. The alternative would be to not have the program at all and leave us with what we have currently, which is the private long-term care insurance system, where premiums are $2,700 a year.
Great, thank you. And the second part of this question is, I'm retired and living on Social Security and a Boeing pension. Does this new law affect me in any way?
No, it does not affect you in any way. This is a contributory program, again, like Social Security or Medicare, and only people who have paid in are eligible for the benefits. So if you're already retired, you don't pay in, and you also are not eligible for the benefits.
Thank you.
So a question from Don and Gary. How does one benefit from this if they retire in the next 9 years, or will they just be taxed with no benefit?
Great question. This is something that is really on our radar. It's something we have flagged for our oversight body, the LTSS Trust Commission. That commission is charged in statute with recommending ways to improve the program. And one of the ways that they're recommending it be improved is that a way be found to make it easier for people close to retirement to qualify for benefits. Currently, if you're close to retirement, if you've paid in 3 out of the last 6 years at the time that you apply for benefits, you would be eligible. So if you paid in 3 years, you would be temporarily vested for benefits. But most people want to be permanently vested, which means for that you have to pay in for 10 years. And we're keenly aware of this issue, that it's challenging for people close to retirement to qualify for benefits. And the commission is likely going to make a recommendation to the legislature to address this issue. And I think there's a good chance that in the next legislative session that something will be done to make it easier for people in that situation.
Great, thank you. The next question from Stephen and Naomi. Why is Washington Care so expensive and the benefits so paltry compared to private insurance available? How did the legislature decide on the program amount of $36,500 and the cost to the taxpayer?
I would say that's simply not true. It's not paltry compared to the benefit. It's a much better deal than private insurance in terms of the relationship between what you're paying in and what you're getting out. Let's think about it for a second. If you're 45 years old today and you pay in you want to retire at 65, and if you are in the typical median wage for Washington State, which is $52,000 a year, you would pay in about $300 a year for 20 years. That's $6,000 for a $36,500 benefit. It's $36,500 today, but it's going to go up with inflation. So by the time you're 85, it'll be more like $50,000 or $60,000. So you pay in $6,000 for a $60,000 benefit. That's a pretty good deal. For private insurance, you would pay in $2,700 a year for 40 years. That's $80,000 to $120,000 in lifetime premiums. Now, granted, the benefits for private insurance tend to be higher, but you'd be paying in 15 times as much in premiums for a benefit that's maybe 3 times as high or 4 times as high, depending on the policy. And the reason why we have a better bang for the buck are the reasons I mentioned before. We don't have underwriting expenses. We don't have claims adjusters. We don't have CEO salaries. We don't have expensive lobbyists. We don't have profit. All of those things make a much better deal through the Walk Cares Fund. I understand the frustration that none of us like to pay into anything, right? I don't like to pay homeowners insurance premiums. I don't like to pay fire insurance premiums. But and I get frustrated every year with my Medicare and Social Security contributions when I look at my taxes. But one day I'm going to be glad that I paid into Medicare and Social Security. And I think if any of us ask our parents, they would tell us that they're glad that they paid into Medicare and Social Security. And I think one day all of us will be glad that we paid into this.
Thank you very much. This next question is several all in one. I think I'll read the narrative because I think you've addressed some of these questions, but it just gives you a chance to kind of recap. This is from Gina and Paul and Aaron. So let's see. Why didn't you ensure everyone was prepared with more private insurance alternatives ahead of time? Why was this written with such a short opt-out window? Why was there only one time period to opt out? And then what about young adults who aren't working yet but cannot opt out? And what about people who move here that gave no option to opt out? And then there's kind of a next section. I'll just pause.
Wow,
there.
That's a lot.
It is. It's a loaded point. Yeah.
Sure.
Do you want me to start, Ben, on it, and then you
Sure,
can?
please go ahead, Ben.
So I worked on this legislation back when we first drafted it back in 2016 or 2017. And the whole concept of an opt-out was really for current policyholders, especially a lot of seniors that had bought into long-term care insurance and were dutifully and responsibly paying their premiums regularly, and they were still working, that we didn't want them to have to pay twice. And then during the legislative process, an amendment was offered to extend the opt-out period to a broader array of individuals for a period of time, and that was determined by the legislature. It was never to be as a tax avoidance, but it was also for somebody to do those calculations, just like Ben was describing, and make their own personal decision about whether the WA Cares Fund was a better deal for them, or if they were a really high income earner. And we calculated that you'd have to make probably $400,000 or more where private insurance might be a better option for you than the WA Cares Fund, just based on what you're paying into it. And so, again, it's a personal decision. You need to do the calculation. There's a calculator that's now available online, but, multiplying your current salary and multiplying it by the 0.58%, and then looking at how long you plan on working and when you plan to retire is the best calculation that you can make. So the opt-out period was never to say to, individuals here, opt out of this, because we didn't want to put them into a riskier pool in the long-term care insurance market, which we know historically has not paid claims, that they go bankrupt, the premiums escalate and skyrocket. I have a woman, an AARP member that, contacted me, and her premiums went up 1,000%. And she's on a fixed income, and she's like, how can I pay this? And I've been paying for 20 years. And that's just how the long-term care insurance market. So we didn't want to be advocating to consumers to go into the private insurance market when we knew it was far riskier, that potentially they would be paying far more money than they would really need to pay for a benefit that they might never ever use. And so again, we really wanted to emphasize the focus on the WA Cares Fund as an affordable, accessible benefit that would be available to a vast majority, 93-95% of all Washingtonians would find this a far better benefit than private insurance. Ben?
Thank you, Cathy. Additionally, I would just, to answer the questions, I would say, you asked why didn't we ensure that there were more private insurance alternatives ahead of time? WA Cares was introduced because the private insurance market had failed. If the private insurance market were able to offer affordable products to middle-class families in Washington State, this program would never have been enacted. It was enacted because for 4 decades, the private insurance industry has been promising that they would be able to do that, and they've tried to do that. I have colleagues in the industry, and they've tried sincerely to do that, but they have not been able. The business model simply doesn't work. It's a case of market failure where it's simply not economical. They can't offer insurance that's affordable to middle-class families that will pay the benefits that people need when they're older. And so because the market failed, the WA Cares Fund was enacted. This past year, private long-term care insurance companies pulled out of the market temporarily. They're going to come back, but they pulled out until the opt-out window was over, because they could see that the vast majority of people who were trying to buy private long-term care insurance last year were simply doing so as a tax avoidance strategy. They weren't doing it to sincerely buy private insurance. Some people were, but the vast majority were trying to buy insurance just to avoid participating in this program. And the private insurance companies knew that they would not make any money off people who bought a policy for a year and then dropped it. They don't make money that way. Their business model is to sell a policy and have you pay premiums over the long term, because they have a lot of upfront expenses to do the underwriting for you and assess your risk and determine your premium level. And if you buy a policy and drop it a year later, they lose money. And for that reason, private insurance companies pulled out. And that's something that's a decision that they made. It's not because of anything the state did. That's simply a decision that they made. I'm looking at I took notes on this question. Any other? Let me see if I missed anything there. But going forward, go ahead. Sorry.
I think you got it. Most of it there.
Okay.
There's a little part there, Lisa. Is that?
There's one more part, but why don't we catch that one at the end so we can move on and try to circle back, and so we got most of that question answered.
Great. All right, I'll take the next question. Then is from David, Carol, and Lance. And it says, why am I forced to pay a tax on something I don't want or need? Why is this a mandatory program / tax? Can we change the law to make it optional?
Great question. And I understand that, most things we prefer when things are optional. I know I prefer when things are voluntary and not mandatory. So I understand that question, but unfortunately, the only way that a insurance pool like this can work is when we all pay in and we all benefit. It's just like Medicare. But think about Medicare, for example, because it's a very similar program, except Medicare is for health insurance and this is for long-term care insurance. With Medicare, if it were voluntary, the premiums would have to be 2 or 3 or 4 times higher than they are. So the contributions that we all pay in out of every paycheck to Medicare would have to be 3 or 4 times higher. And the reason is because if it were voluntary, then sicker people would participate and people who are very healthy would not participate. And also high earners would probably not participate and buy private health insurance, and lower earners would stay in Medicare. And as a result, Medicare would get less money in terms of premium revenue, but have higher expenses because sicker people would be in the risk pool. And that would make Medicare premiums spiral upward and ultimately make Medicare unsustainable, and we'd have to get rid of Medicare. And that's why Medicare is a mandatory program. Social Security is the same logic. Same thing with workers' compensation or with unemployment insurance. All of these types of public insurance programs are based on the idea that it's a mandatory program, we all pay in, and we all benefit. I hope that helps explain.
The other thing I would like to add to that is I hear a lot of people say, just like this person commented and said, why do I have to pay this when they don't feel like it's something they need? Well, what we're basically also doing is that if this program is self-funded, and so the people pay in a premium and then they access a benefit. If this program was not around, because of the age wave that is coming, and we're having more and more people aging, and which is fabulous. There's more people turning 80, 90, 100 than ever before in history. And yet, how do we care for them? And the way that we typically care for individuals as they age is through Medicaid. And guess who pays for Medicaid? The taxpayers. So I always say, you're going to either pay for it through your taxes, or at least you have a self-funded program that is paid into by individuals to help defer some of that tax burden that all of us are going to have to bear as individuals age.
I agree. Thank you, Cathy. That's a great point. And this kind of approach that we're doing through the What Cares Fund is a much more responsible approach, because we're planning ahead. We're all paying in, and throughout, when we're able to work and we can afford to pay in because we're working, we pay in. And then when we find ourselves, having fallen down the stairs or in the shower or getting a medical diagnosis, and we're retired or disabled and we don't have any income except our Social Security, then at that moment, when we're most vulnerable and most desperate, we have access to a $36,000 pool of money, which will be more like 50 or 60,000 by the time I'm 85, that I can use in that situation to hire a home care aide, so I can stay in my home. So at the time when I most need help will be there for me. Whereas right now, what I would have to do is apply for Medicaid in that situation. And then I would have to disclose all of my income and assets to the government. They would make sure that I'd spent down all my assets to less than $2,000. And then I would have access to Medicaid. And there are a lot of rules around Medicaid, federal rules, state rules. I might end up having to go to a nursing home, even though I want to stay in my own home, and which would be frustrating to me. With the What Cares Fund, it's an earned benefit. And if I need care, I have access to the money, and I can do whatever I want with it as long as it's paying for long-term care. I could hire a home care aide. I could pay a family member to care for me. I'm in control of my life in that situation. Whereas currently, if without the What Cares Fund, I would be at the mercy of the government in that situation, which is a place most of us don't want to be.
Thank you. So our next question is from Naomi, Martha, and Denny, and there's a few parts to it too, but I think you've covered a couple. So I'm just going to highlight the ones I think we still need to address. How can you rationalize this program for people moving out of the state? Why are the benefits not portable? And why doesn't the plan allow for an opt-out period for someone who moves in to the state?
Those are great questions. I think originally, I think, this is a very complicated program to design. And I think it was an oversight, I think initially, that there wasn't a plan made for what happens when people leave the state. I think that's something that we're looking at carefully now. We're doing research on it. We're talking to other states. It's a complicated logistical challenge that it's solvable. And I think we will get there. Today, we don't have the solution, but there's 49 other states. And so, if you leave Washington State and you move to Tennessee, we need to have a system for sending someone to your home in Tennessee and assessing whether you really need care. Because we're not going to just write checks to people, because that would result in fraud, where people who didn't need care said they needed care and they got a check. So we need to do assessments. So we need to develop a system in partnership with other states for doing assessments in people's home in 49 other states. And then we have to figure out a way for people in other states providers in other states to bill the state of Washington for care provided. And that's something it's going to take a couple of years for us to develop systems for. It's something we're starting to work on now. And I think in due time, we'll have a solution there. The second part of that question was, what about people who newly enter the workforce, either by moving here or by turning 18? Well, that for them, it works just like Medicare works. My son is 17. A year from now, he's going to turn 18, and hopefully, fingers crossed, he'll start working. And when he does, he'll be paying into Medicare and Social Security, just like the rest of us. And when he's older, he'll have those programs at his disposal when he needs them. And this works just the same way. It's a universal program, as I mentioned before.
And we're also hoping, that more states come online with a very similar type of program. We know that there's already California, for example. I talk with my colleagues on a pretty frequent basis about a very similar type of program. We also have heard there's, several other states that are looking at something comparative, because they all recognize that they are all going to have to face this unprecedented number of older adults that's coming as part of this age wave. It's all the baby boomers. The last birthday was 1964, and they're aging, and they have not anticipated what it costs for long-term care, and they have not saved adequately. And so what we're really hoping for is that we can continue to move this forward as a very viable solution, and that we can address some of these very, basic administrative questions. And we have some time, especially the one about the retirees. We have time to really do work on that, and also look at what type of benefit would be logistically feasible and administratively doable.
Great, thank you. I'm going to kind of go to a general question here to the two of you, Cathy and Ben. Is of all the things, you're very well versed in this program, of all the questions asked here, are there any questions you think that people have asked at other ones of these type webinars or other places you've gone that you think didn't get asked, that you'd really like to share that information with our audience?
Cathy?
Well, I think a lot of people, are, kind of like one of the previous questions, why are we doing this and why are we doing this now? And, again, I think we've kind of talked through this, and I know there's a lot of, they're starting to get some buzz around, people wanting to, delay this or change the program drastically, or, and I think that very much is the wrong direction. What a lot of people are trying to do is basically making it harder for Washington families to afford and access long-term care. And, what you don't hear about as much are a lot of individuals that I talk to on a regular basis, that they're really struggling with their long-term care, and they can't afford it, and they don't know what to do. They're out of options. and the only choice that they have is going on to Medicaid. And I think what anybody wants, in their life as they age and get older is that they have a choice and they have options where they can choose how and where and when and what they want to do as they age. And I think people don't think about that, especially, myself. I don't think about it as much as I probably should, even though I'm in my 50s. But I think, as people age, you start thinking about it more and more and more. And I know my 20-something daughters are not thinking about long-term care. But how do you get the next generation to really wake up and see what's happening? And I know, at least for my daughters, we had the experience of my grandmother or their great grandmother with Alzheimer's, and now my mother and their grandmother also with Alzheimer's. And so we're having these conversations about long-term care and what my mom wants to do as her Alzheimer's progresses and how she wants to live. And so I think it's less about the questions that we get, but it's also about just hearing people's life stories. And for each individual, it's so unique. And, if you have family around you, or do your family live like Ben's example, half, all the way across the country? What resources do you have available? Have you tried to save for this? And so really it's, one of the great things about the WA Cares Fund is I go to parties now, even over Thanksgiving. This became a topic. Who talks about long-term care over Thanksgiving dinner? And I've been to, a friend's house and we're having a glass of wine and all of a sudden long-term care comes up. And people share with me their stories of, my partner is HIV positive. And I kind of wait, I don't want to have these conversations at a social event. But he's like, I'm so thankful for the WA Cares Fund because I have a pre-existing condition, or his partner has a pre-existing condition, and we don't know what we would do because we would not qualify for private insurance. And so I think people need to recognize that this is going to be a benefit that's going to be there for them and for their families, because caregiving is not just about the individual. It's about the burden that is often placed on women's shoulders to care for an individual. And at the same time, it jeopardizes their future ability to make money and provide for their own retirement. So one of the things that AARP was really excited about is, again, the choice and options that this gives. People can use their benefit to construct a wheelchair ramp on their house. That's all they need in order to, be able to provide for their long-term care needs.
I wanted to thank you very much, Cathy. I think that was a good wrap up. And there are just two short questions. I know we've only got like 3 minutes left, so super tight answers. But one of the questions that has come in that I didn't finish on an earlier one was about what happens with the individuals who are still waiting for their policies to issue. Will the state recognize a back date of 1031 as being issued and satisfy the exemption rule? I think that's just an operational question that maybe we can answer real quickly, and then we'll be sure and get you information if there's other information or questions that each of you have.
That's a question for the Employment Security Department. They administer exemptions, so I encourage you to go to our website, wacaresfund.wa.gov, and then click on exemptions. And then there's a link there to there's an email address there for ESD, for the Employment Security Department. You could pose that question there.
Okay. And if you're in that circumstance, please, and you feel like you need some help supporting you in getting those connections, please reach out to our offices. I want to say a huge thank you to Cathy and Ben for being here and helping to share information. There are resources, as Ben has mentioned, at the WA Cares Fund website for you to go. There's a frequently asked questions list. And then I know that Rep. Ramos also understands that each one of you have your own unique circumstances and how this is showing up in your life. And so it is critical to understand what that looks like and means. And we like hearing about how that is showing up for you so that we understand how we can work in the legislature to make sure that this is truly an affordable, accessible program that's going to benefit all, and figuring out how that works. I do know that the commission's recommendations, I think they have a report due in December on some of these areas that we talked about that of how it can be improved. And so we're looking forward as legislators to see how that plays out in the upcoming session. And I know that some of you may have heard about a pending lawsuit. And I believe at this point, as far as I know, please correct me, anybody, if you know anything different, that at this point, everything is moving forward as planned with the Washington Cares Fund to start in the beginning of 2022. So that's that's the latest and greatest stats as we understand it, information that we know. And I am deeply grateful for all of you who tuned in. I know, again, that this is touching everybody in Washington who's working, and certainly those that are not working that will wind up in caregiving roles and so much more in the health and well-being of each and every Washingtonian. So thank you for that. And Rep. Ramos, do you have any other closing comments that you'd like to provide?
Again, just thank you very much for your time listening. I hope this was informative for you. I imagine as you heard all the answers to these questions, you probably got a question or two more out of it as you heard these answers. So please reach out to our office, our assist. I guess we're done. Our assistants. There you go. Our assistants are available, and our email was on there, I believe, Erica Boyd and Zach Hall. Send your questions in to us. We will be happy to continue these questions. One last question was, can anybody get this who couldn't make it? Also write to our office, and the link to a recording of this will be available as well. So your friends can watch it, and you can watch it again if you want to. So thank you very much. And I think that's it. Have a great evening again. Thank you, Ben and Cathy. And I hope this was informative. Have a great evening.
Thank you, everyone.
Thank you all.
Thank you.